Thyroid health is a very hot and widely debated topic. It can be really hard to know what's true, what's hype, and what, if any of it, may be able to help you actually feel better. In this video, we'll give you the science-based education you need to understand your thyroid health and to know when it's just your thyroid or if that's just part of a bigger issue. What is the thyroid? The thyroid is a small butterfly-shaped gland in your neck. But don't let its size fool you. It plays a huge role in nearly every system of the body. Thyroid hormones affect your metabolism and energy, your body temperature, your brain function and mood, digestion, your menstrual cycles and fertility, skin, hair, and nail health. So what is hypothyroidism? It occurs when your thyroid isn't producing enough thyroid hormone, or when your body isn't activating or responding to those hormones properly. Some very common signs of hypothyroidism include fatigue, weight gain, even with low appetite, constant coldness, mood changes like depression or anxiety, brain fog, constipation, irregular or heavy periods, and hair thinning. These symptoms can vary in severity and overlap with many other conditions. It may even be that other conditions are the root of your actual thyroid issues. This is why context, testing, and deeper evaluation are so important to understanding your thyroid health. What's the difference between Hashimoto's and non-Hashimoto's hypothyroidism? Not all types of hypothyroidism are the same. One common cause of hypothyroidism is Hashimoto's. This is an autoimmune condition where the immune system produces antibodies that attack the thyroid gland. This attack doesn't always cause an immediate drop in thyroid hormone. You can actually go many years with Hashimoto's before your thyroid hormone levels drop. So you can be positive for Hashimoto's, but not yet hypothyroid. Eventually, though, with that autoimmune attack, as it still continues, your thyroid will break down, you won't be able to produce enough thyroid hormone, and then you become hypothyroid. Another type of hypothyroidism that's a little less known about occurs without any autoimmune attack. It can result from long-term conditions that dysregulate your thyroid, such as stress, chronic inflammation, illness, or environmental factors, and this may not show up clearly, especially in conventional medical labs. Some people may have subclinical hypothyroidism, meaning their main labs might look normal or just slightly off, but they still experience real symptoms of low thyroid function. If this is you, then it's likely that there actually are other issues that are driving your subclinical hypothyroidism. So it's really important to identify and address those other issues and not just to hyper-focus on only treating the thyroid. It's also really important to remember, even if you're experiencing weight gain, fatigue, constipation, low mood, it might not be your thyroid at all, or just not only your thyroid. These symptoms can also come from many other imbalances in the body. So how does thyroid signaling work in the body? And why might not standard labs always pick up on the full story? It all starts with your pituitary gland, a small P-shaped gland that situates right about here, connected to your brain in between your eyes. The pituitary gland monitors what's going on in the body and signals your thyroid via thyroid stimulating hormone to tell your thyroid to secrete the hormone T4. Think of T4 as the raw material supply for your thyroid hormone. Your body then has to convert T4 into free T4 into total T3, and then at the cell level, total T3 has to convert into free T3. Free T3 is the money maker. This is the active form of thyroid hormone, which is what your cells actually use to create energy, support your metabolism, and keep all of your thyroid-related functions running. In conventional medicine, TSH, or thyroid stimulating hormone, from your pituitary to your thyroid, is the main marker used to assess thyroid health. But think of this more like a thermostat. When thyroid hormones are low, your pituitary can sense that and increases thyroid stimulating hormone signal to your thyroid, trying to tell it to increase how much thyroid hormone it is secreting. Conversely, if you have way too much thyroid hormone in your body, your pituitary will sense that and decrease the thyroid stimulating hormone to your thyroid. But that's just one piece of the picture. So in conventional medicine, they're really looking at whether or not your pituitary is monitoring your body and signaling appropriately to your thyroid. Thyroid stimulating hormone, however, doesn't tell us whether your body is converting the T4 to T3 or to the free T3 at the cell level. It doesn't tell us if inflammation, stress, especially the hormone cortisol, nutrient depletions, or cell dysfunction could be blocking you from having active thyroid activity at the cell level. And then there's not terribly common but overlooked condition where the hypothalamus, the part of the brain that works with the pituitary to monitor the whole body, when that happens, thyroid stimulating hormone can actually look normal. It won't increase or decrease in response to different levels of thyroid hormone in the body. You will have normal TSH even even though your thyroid hormones downstream might be inadequate. So remember, so many other things can cause symptoms that are often related to poor thyroid function, such as fatigue, weight gain, hair loss, and depression. So it's really important to think about, is it really the thyroid? Is it just the thyroid? If it is the thyroid, what are the reasons why the thyroid might not be functioning well, and to address those other things. Otherwise, even if you feel better on thyroid medication at first, those other issues are going to catch up with you and you'll still end up not feeling the best even when you're properly medicated or if your thyroid isn't the real problem. How do you treat it if you do have thyroid issues? For some people, thyroid hormone medication is absolutely necessary. This includes cases where Hashimoto's autoimmune disease has progressed and the thyroid just cannot make any more thyroid hormone or can't make enough thyroid hormone, or chronic illness, natural aging processes, or too much or too long stress can also long-term impair the body's ability to convert the T4 into the active free T3. If we can't correct the illness or natural aging process or other issues, it can be really necessary to medicate. But many people still don't feel well even with proper medication. That's because your thyroid health isn't just about adding hormones. Your body needs to convert that T4 into the active T3. You need to have adequate nutrients to support production and conversion of that hormone, manage inflammation and stress that can block thyroid hormone production, and compromise energy and metabolism in completely other ways. Supporting adrenal health, gut health, the nervous system, all of this can cause the same symptoms and affect thyroid health. So it's really important to understand all of the reasons why you might be experiencing symptoms of hypothyroidism and address them. So the different things that we can look at that are important to thyroid health include your gut microbiome, balancing, controlling inflammation through nutrition, lifestyle, or medication, supplements, herbs, blood sugar balance and insulin sensitivity, adrenal health and cortisol regulation, nervous system work if you're dealing with chronic stress or trauma, and replenishing nutrient deficiencies that are key to cell health and thyroid function. Mitochondria and cell function can also impair your thyroid hormone activity as well as create symptoms similar to low thyroid. So there's a lot of talk about the different types of medications, whether you want just a T4 synthetic or a natural glandular. In conventional medicine, they most often prescribe T4 only medicine, levothyroxine, the generic Synthroid. In functional medicine, a lot of providers lean towards using a natural product or a glandular that contains both T4 and the active T3, free T3 hormone. The reason they do this is because they are giving you the free T3 in case that you don't convert to that free T3 from the inactive T4. However, remember, we want to correct the reasons that you aren't converting well from that T4 to that active free T3. So in our practice, it's very individualized, but in general, we prefer to try to correct the reasons for poor T4 to T3 conversion, giving T4 medication primarily, and hopefully allow the body to decide how and when it wants to convert, at what levels, to how much thyroid hormone to keep the balance. One of the other reasons for this is because T4 hormone is just a longer, more stable hormone. It lets your body decide through its other many mechanisms how much active thyroid it wants in what levels and at what times. T3 or free T3 is a short-acting, hotter burning thyroid hormone. You have to often take it more than once a day. It isn't as stable, it isn't as long-lasting. This can cause more hormone spikes, highs or lows, and is more likely to suppress your own body's internal production of thyroid hormone because your pituitary is sensing all of that hot burning T3 out there. Ideally, we would aim to heal the reasons why your body isn't converting that T4 into the active T3, deal with all those other health issues, and allow your body to fix the conversion issue and give you the T4 if you need that medication, rather than jumping straight to giving you T3, suppressing your own internal production of it, and not going after the poor conversion causes. So sometimes it's not just your thyroid. Thyroid health is so important, and if you're noticing symptoms you think are thyroid related, keep watching, because many conditions can mimic or worsen thyroid symptoms. So we need to look at all the other things that could be affecting it. These include inflammatory or processed food heavy diet, poor or inadequate sleep, a sedentary lifestyle, gut dysfunction, chronic inflammation, nutrient insufficiencies, mitochondrial or cellular dysfunction, hormone balances including cortisol, estrogen, and insulin insensitivities, and nervous system dysregulation. So it can be a little confusing. You could have low thyroid, your thyroid labs could be a little off, and you could have other health issues that are either exacerbating these symptoms or creating the thyroid issues. Or your thyroid labs could be completely normal and it's actually more just these other issues. It's really important to get a good investigation. And so that's why we don't just chase thyroid hormone lab markers. We want to look at how your thyroid hormones, gut, immune system, nervous system are communicating and affecting each other. Symptoms can be clues to help us understand what needs support, what needs correction, and how to restore balance at the source. Conventional lab analysis of thyroid labs don't help analyze the nuances about your thyroid health or what else could be going on that is either directly relating your thyroid health or mimicking symptoms of poor thyroid health. That's because most conventional medicine is designed only to detect disease in a single area of the body and then to medicate it only when labs have crossed a more serious threshold of pure hypothyroidism. This leaves many people struggling without relief with symptoms such as fatigue, brain fog, poor digestion, poor sleep, slow metabolism, and poor mood. A thyroid medication prescription can be game-changing, but if the underlying drivers and other issues contributing to these symptoms aren't identified or addressed, the symptoms can come back. Your thyroid works in synergy with the rest of your body. It's connected to your brain, your gut, other hormones, your immune system, cell health, normal aging, and the stress response. So how do you know if you need more in-depth thyroid support? If you're on thyroid medication, but you have to constantly increase or decrease the doses every time they test you or try new medications. Or if you're on thyroid medications, but still having ongoing symptoms. And also, if you think you have hypothyroid, but your labs are only subclinical or are normal, then it's probably time for a proper in-depth InHealthRVA functional medicine evaluation because there's just more going on than just your thyroid. We can help you identify what issues are driving your symptoms, clear the fog around thyroid health, help you understand if it is your thyroid, if it's not, or if it's all of the above, and support your own ongoing wellness through the different ebbs and flows of life. At our clinic, we believe your healthcare should help you feel well again and not just manage the symptoms.